Hello and welcome to another Conversations with Dr. Westman. Today's topic is, are you on type 2 diabetic medication? We also have a bonus for you, and it's Dr. Westman's free 8 ways to kill sugar cravings, and we'll put a link for you in the description. How are you doing, Eric?
Doing great. Thank you. How are you?
Very, very good. Thank you. And thanks for joining us again. This topic just happens to be one of the most type 2 diabetes, one of the most common illnesses that you see in your clinic. We've spoken about medications in general, but we wanted to drill down specifically for type 2 diabetes. So once a doctor prescribes type 2 medications, will this actually fix the problem?
Right. Well, actually not. I mean, in the language you can hear even on commercials for diabetes medicine is, here's how you manage your type 2 diabetes. It doesn't fix it or reverse it. And so this is an important point, that for most people with type 2 diabetes, they can actually reverse it and fix it. They don't have to be managing it with medications. But we teach our doctors today, even at a place like a major US university, we teach doctors how to manage diabetes with medications. And the problem with that, if it was a great way to help someone live a long life and not have problems from diabetes, that'd be great. But the problem is that it doesn't fix it, and it manages it. And in general, you go from 1 pill to 2 pills, and the pills to shots, and then shots to higher dose insulin shots. And, so it's a never-ending pathway down medication treatment of diabetes, and you don't have to go down that path. We're trying to talk to people even before they're getting medications for this. There's another way to go about it, and that's lifestyle. I mean, spoiler alert, it's lifestyle, lots of different healthy lifestyles, including the keto lifestyle. But just consider that there are other ways to do treatment of these conditions aside from medications, and most doctors have been taught the medication approach, not the lifestyle approach.
Now, when these patients come and see you in your clinic, how many of them are currently on medications for type 2 diabetes?
Well, I was remarking this last week that there was someone who was 70 years old and was not on any medicine. And that was just so unusual, because in the US, if someone has been in the medical care by age 70, they're on 2 or 3, 4 medicines. And this person had actually not eaten the typical American diet and was exercising and using lifestyle instead of medications. But so the kind of tragedy is that once you start using pills and shots, some of these medicine, or actually most of these medicine, actually compound the problem. So for most people with type 2 diabetes, obesity is one of the root causes and contributors. So there is the diet, but also there's obesity. And so if you get put on a drug that makes you gain weight, this does not ever fix the diabetes. So if you get put on a pill or a shot that, like insulin, that causes weight gain, what the doctor is doing is, I think unwittingly, I don't think doctors do this on purpose. They don't know. Doctors are actually giving you diabetes forever, because they're putting you on a medication that makes the obesity worse, and the obesity contributes to the diabetes. So that's the pathway of, once you get on a medicine, and if the medicine causes weight gain, and the doctor doesn't address weight gain, you're just going to be having diabetes forever. And when you talk to a doctor, they'll say to you, well, you're going to have diabetes forever. So partly because they're putting you on pills and shots that gives you diabetes forever.
So now, now that you've just said what you've said, let's try and understand. I'm a patient. I go see a doctor, and the doctor is now recommending medications to me. What should I do about that?
Right, for diabetes, so it may even start with pre-diabetes. Let's say the doctor checks the blood sugar or the hemoglobin A1C, which is a marker of blood sugar over 3 months, and they say, well, you're going down that path of pre-diabetes or diabetes. I want to recommend this pill. The most common ones are metformin or a sulfonylurea like glipizide or glyburide. These are pills that doctors will give for diabetes and pre-diabetes. The alternative, and what you want to ask the doctor is there, something else I can do, like change my lifestyle? And now, be forewarned, most doctors are not trained in effective lifestyle treatments. So their experience might be, well, there's no lifestyle, just take this pill. And I've even heard people say, well, metformin should be in the water. It's so good. It's anti-aging and all that. I mean, this is the selling of drugs and pharmaceuticals that really is kind of sad that that we've come to this. I mean, I'm even kind of wrestling with, what's happened to my profession. I went into this field to be a doctor to help people cure things and prevent things. And now I just manage things. And, I'm not alone. A lot of doctors come over to the lifestyle treatment or obesity medicine treatment. And as past president of the Obesity Medicine Association, there are a lot of doctors who wake up and learn a new method, including lifestyle. But so early on, if a doctor is saying, you need a medicine, ask, is there something else I can do? And if the doctor says no, just take a pause and do some research. Dr. Google is great and terrible all at the same time, but there are effective things you can do besides taking medication. And I remember several of my patients finding me personally because they didn't want to go on the medication. They didn't want to go on insulin. And so they were looking for doctors who thought there was another way. And now, the keto approach has been validated now for 20 years. I've been using it for 15 years at Duke University in my clinic. So there are effective lifestyle treatments that can work, but the doctor may not be aware of them.
So, that's other doctors. Now let's talk about you and your clinic. So if somebody walks into your clinic and they come and see you, walk us through what you would do to, or say to them. They're currently on medications. They come and see you. Now they've had their meeting. What are you going to suggest?
Well, so I see people at all stages of this process. People who are healthy, they don't have prediabetes. So for prevention, this works great. If someone has prediabetes, they're only on one medicine, that becomes pretty easy because I just say, here's the alternative approach, and you can stop the medicine immediately, which is, most people are shocked that I can say you can stop that medicine immediately. So if you're only on one pill, for example, for diabetes, it's not a big deal. Of course, I would teach you how to cut out the sugars and the starches and do what I like to call the prescription strength keto diet, using real foods, not fake foods and products. But that's another discussion. We've done lots of videos on how to do this. But if someone is coming to me in a medical clinic, I'll check the routine or make sure they've had the routine blood work done in the recent past, make sure that a thyroid level has been checked. And I like to do 3 or 4 different thyroid tests, not just one. And then I want to make sure that there's no underlying complication before someone starts. Again, this is the medical clinic view. For example, if someone has a history of heart failure, I need to be careful about certain things. If someone's on a blood thinner that requires attention to the leafy greens and the vitamin K, we need to talk about that. But more and more people come to me, they're already on pills and shots. And now they're on shots that aren't just the 100 units per milliliter strength. It's on their 500 unit per milliliter strength. So the giving insulin to fix type 2 diabetes doesn't work. It manages it, and then the body just says, enough is enough, and so you escalate the insulin. So if someone comes to me and they're on the pills and the insulin all at once, I want to make sure they understand what insulin does to the blood. And it's fascinating. Some people don't know, but they're given insulin to use. So it's like, I think it's like giving someone a motorcycle and you haven't taught them how to ride, or a bicycle. And so I want to make sure they understand that insulin lowers the blood sugar, and most of the dietary contribution of blood sugar comes from the carbs. So your insulin is titrated to the carbs in the food. So when you cut the carbs out, which is what I'll teach people to do, you have to cut the insulin down on the first day. So, it's become so routine to me. It's almost, people come to me and they're just shocked that I've taken people off insulin on the first day that they've changed the diet, because I don't want them to have a low blood sugar. A low blood sugar can make you pass out or faint or feel terrible. And so I avoid those. And you have to adjust the insulin on the first day when you use this kind of keto sort of program, which is one reason why dietitians shy away from it. They're not trained in it, but I am. I'm a physician, and so I take charge of the diet and the medication all together. And then, it's a process. If someone's on diabetes medicine, they're probably on high blood pressure medicine. So I monitor the blood pressure over time, and usually takes more than just a few days or weeks for the blood pressure to come down. Depends how heavy the person is, how much obesity and insulin resistance there is. So actually, we call this now de-prescribing. De-prescribing is the method of taking people off medications when they've changed the lifestyle and they no longer need the medicine. So I can understand there are doctors who aren't trained in this, and they would think that this is overwhelming. To how do you manage the blood sugar and the blood pressure and all? But it's actually not that difficult. You just have to monitor these things and tell people, here's the guardrails to stay within. Make sure you're monitoring the blood sugar at home, the blood pressure at home. But I've seen and I've helped people get off 10 medications.
That's incredible.
So lifestyle is potent. Or the other way to say it is, the food that a lot of people eat, the typical American diet, is really harmful. And but it's such a slow process. It's hard to, they say you can boil a frog if you just increase the temperature slowly. It doesn't perceive the heat. It's the change in heat. So it's a terrible metaphor. But if someone is just slowly getting on one medicine then another, and it's really kind of like the path of least resistance, right? You're eating the same foods, just getting managed with medicine. But the reward I get is people feel great. They come back, they thank me for helping them. And we're training as many doctors as we can to do this, but many of them just don't know how powerful it is. We actually have created a new organization called the Society of Metabolic Health Practitioners. This is Doug Reynolds from the Low Carb USA programs that he's put on. Doug and Pam Devine, his wife, started the Metabolic Health Professional Organization to attract doctors, nutrition people. Actually, every field is welcome to join this group so that we can train as many people as we can, as fast as we can, about the effective lifestyle treatments, not medication management of these problems. You don't have to manage type 2 diabetes, you can fix it.
That sounds absolutely incredible. But I wanted to ask you, if somebody comes to see, if 100 people came to see you, and they implemented the ADAPT program, what sort of success rate can they expect? And they stuck to the program religiously, and they had type 2 diabetes. What sort of success out of 100 people would you see?
Yeah, so the way I say it in the clinic is like a prescription. This program, which I've boiled down to a sheet of paper, the ADAPT food list, it will work like a prescription drug if you do it. So it's 100% effective if you do it. So the problem is people go home, the spouse feeds them carbs, the environment isn't devoid of carbs. So the studies where people go into the hospital or metabolic ward, research ward, it works 100% because they have total control of the food. And in the residential treatment programs in Durham, North Carolina, Duke used to have one. It's 100%. Because people are on the premises of the program and they're following the food list 100%, it will work. So it's not 100% effective for people who come to me because people go home and they have, I miss my this, I miss my that. But when a doctor like me says, here, this will work, then that helps people know that they might have cravings for a couple of days and they might miss that or that, but it's like a prescription. And that the doctor gives you the confidence that it's going to work, then you're going to do it. Imagine, you have that sinus problem. Here's this expensive medicine and I want you to go get it and it might help your sinus problem. Doctors don't do that. They say, here's your prescription for your sinus problem. Go get the antibiotic and you'll be fixed. And that's the way, the confidence that I have about this program we have, because we've studied it and put it to the test so many different times.
So let me finally ask you one last question. Let's understand there's a person that currently has type 2 diabetes. They're currently on medication. You are not their doctor. What advice do you give them? Let's say their doctor does not know about the lifestyle option. What do? They're currently on medication. They want to implement the program. What do?
Yeah, so if someone comes to me as a consulting physician, consulting doctor, I take charge of the diabetes and high blood pressure medicine, because most doctors don't know how fast these things can change. If someone's on a chronic medicine for a psychiatric illness or other sort of metabolic issue that I don't see changing a whole lot, I let the other doctors take care of that. And sometimes I communicate with the other doctors directly. Most commonly, I just inform the patient, get them to understand what's going on, and they inform their doctors about it. But it's really important not to change your medication yourself. Either have a doctor who's trained as the consulting doctor like me. Well, there's even the Virta Health company will help you, and the doctor's in your phone, doing consulting at a distance, but it's not widespread around the US yet, or worldwide. But I will take charge of the medicine in order to avoid the medicine from becoming too strong.
Fantastic. Well, thank you so much for your help in this particular issue. I know that it's a big one, and you see a lot of people in your clinic with type 2 diabetes. So thank you so much. That's all we have for today, folks. Don't forget to get your bonus, Dr. Westman's free 8 ways to kill sugar cravings, and the link will be in the description. If you want to learn more about Adapt Your Life Academy, we've run the Keto Made Simple Masterclass by Dr. Eric Westman. We've run 2 courses already. We have a third that's launching, I believe, at the last week of April. So you can go to adaptyourlifeacademy.com, click on the Keto Made Simple Masterclass and join the waitlist. And when that course opens up, you'll be alerted. Eric, thank you so much. We really appreciate your time. Until next week, that's all we have time for. And thank you so much.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.